Definitely, healthcare is one of the booming sectors of the country. If you see here, it is growing at a CAGR of 16% plus. Hospital industry alone within the healthcare domain, which is 80% of the whole healthcare sector, is $132 billion worth of sector it is now. And hospital remains the backbone. If you see here that the investments into the healthcare or health tech startups is growing at 45%, which is amazing. Even the hospital beds addition is growing at 40% plus, and total employment is 47 lakhs. Directly, indirectly, it is more than 20 times. And it can generate more than 27 lakh new jobs and 5 lakh jobs annually in the healthcare, which was in 2020 at $5 to $6 billion, has the potential to reach to 13 to $15 billion by 2026. Diagnostic industry is a very big sector, which is now at $4 billion, which is growing. Among all the subsectors, diagnostic sector is growing at 25%, which is one of the highest, in fact. 15% the labs and 10% the radiology sector. Doctor to population ratio is a debatable subject. I don't want to get deep into it, but it is at a very stable position. My position on doctor to patient ratio is not the number, is the purchasing power of the people. If 500 people's purchasing power is more, the ratio is 500 or 700, it doesn't matter. Then investment in the medical education sector is also hopingly growing. It's around 17,000 CR now. 157 new medical colleges have been added, and this number has to grow much more. Now, how the balance will be brought in is different. Now, government has given 100% FDI through the automatic route in the greenfield projects in the healthcare sector. We will discuss what are the challenges yet. Medical equipment import has also gone up by 41%. This shows also the opportunity that the domestic manufacturers can leverage in terms of the rising demand of medical equipments in the country. These are some of the major reasons why most of the healthcare fails, or which our experts today will discuss in details. Dr. Rajkumar will actually glance through why and how healthcare businesses succeeds and fails. These are some ideas in different domains. I put this in perspective so that we set the direction. Online medicine delivery is one of the rising business. Medical transcription services, one of the rising business. Online store for supplements is growing very, very fast. Online fitness training is growing very fast. Online doctor appointment and telemedicine is growing very fast. Dr. Natesh will also enlighten us on these areas. Online medical record, like DigiLocker, is going to boom. Then hospitals, health insurance, pharma, biotech, medical devices, equipment, diagnostic, all these sectors. Within all this, home care is again emerging as a very, very innovative, sharp niche domain. And in future, this home care business is just going to grow. Maybe in future, what I see in perspective is 20, 30 years down the line, people will be doing operations at their home itself. These are a couple of famous startups, successful startups in India. And these are a couple of successful startups in Bengal, which have achieved substantial success. These are a couple of compliances when it comes to opening a hospital and issues.
That somebody says, I'll save, compared to Sanjay Banerjee, I will save 5% for you, 10%. He will save, but you will lose 6 months more of operating time. And in that 6 months operating time, you will lose a lot of money. So number one, if you're an operator-driven guy, start quickly. Link up to people like Sanjay, like SI Surgicals, who will give you a complete, you say, I want modular theater starting on July 1st. I want it by August 15th. Kalas. And then you outsource it to him. He should do the job. You lose money when you do that. Number two, you lose money if you're an operator-driven person. You will have unscrupulous GPs coming to you and saying, give me 30%, give me 40%. I will send you the work. Try not to, especially our boys in the Northeast, a lot of work is happening. My advice to such GPs is, you want to be a businessman, fine. You have a big practice, fine. You start a nursing home. That's ethical business. If you send an appendix to a patient surgeon and say, give me 30, 40% of that, then the whole public attacks us. MPs, MLAs, I talk to MLAs, MPs, ministers all the time, and they're all talking about this cuts and kickbacks. So by creating your own system, instead of taking kickback from a surgeon, you create your place, get 2 Sanjay Banerjees, create a hospital and get the surgeons to come and operate on your place. Then you are fully justified. So this is the dynamics of an operator-dependent system. We need a coffee. Half cup. Second, you're creating an ecosystem. And for this, my advice to youngsters is, don't make the mistake that I made. Get 5 or 6 people together who will all invest small amounts, who are in different areas. For example, a very successful group that the surgeon, his wife was a dentist, his brother was an anesthetist, the brother's wife was a pediatrician, and they had these 2 brothers had one sister who was a facial-maxillary surgeon, her husband is a psychiatrist. All 6 different areas, they all pooled money together, they started a hospital. It's doing very, very well. one couple takes off on holiday, the others make. Remember that whether you're dealing with business, politics, or life, those who give most will get most.
And everything we can do for our newly upcoming who doctor are making the hospitals, who entrepreneur making a hospital, that type of hospital we have to do last 12 years. So that is really I proud. The people are support with me. But after when I successfully increase the business, so I thought, no, every people can do this type of business. Suppose when we have to support for vendors, I am talking about for the small vendor, if I can develop so that after that, this advantage we people are enjoying. So nowadays, my thinking is that the small vendors, we can grow up. So that now we have a this thinking. Hopefully, you people are support with me. So definitely we can good work together.
Actually, this thing means like this policy times, we got the agenda to make actually the creation of entrepreneurs like you start off. I mean, small people who are very much interested to make the things over there, small hospitals, small nursing homes, small paramedical setups, small different areas, different particularly specifically who are much interested to make small startups, not the bigger one that you were talking already, sir. So these startups, so many people are there, they are having ideas, but they can't make it out completely because of their, discrete thoughts. What I got actually, sir. So our policy times basically view was to make all those, to come and do all the CMEs, small workshops, and physically and over the Zoom, virtually, both the areas, and to make max possible the small entrepreneur to come out from their areas and to start off their startups, new small startup. Out of that, where the benefits comes, like diagnostic center, this much values will come. Small dialysis center, this much values will come. Big hospital, these are the headaches, these are the advantage, how to start off. Many people have their own ideas, but they don't know actually how to start off the things. So our policy time specifically, sir, thinking right now to have new doctors, who are the in the process of getting their entrepreneurship. So we are taking them in this kind of platform, virtually and physically, both. And we are planning to have these different areas in West Bengal, because West Bengal doesn't have this kind of picture at all. They don't have a mindset, or they don't have a corporate pictures in their mind. So they're very confused. So actually here we are going to start, because already we have started that in Siliguri, and we are very much successful in that, to have some hospitals, to have some areas where we can, small setup. It's not a very big areas we are thinking of, that having helipads and all those, but at least we can have their own startups from the beginning, different areas. And apart from this, in the West Bengal, differences are like nowadays, oncology is in the hype of. So some people are there, some doctors are there who are very much competent to do the like oncomedicines, oncosurgeons, and even who are the PET scan, like radiologists who are doing day and night reporting for the PET scan and all those. People are there. They are planning to start off under single roof, one good setup, but they don't know how to jumble up. So these kind of people, because we are having like SI Surgical, Sanjay is there. Like your brainchilds, people are there. Like other areas, other fields, doctors are there. So how they can go ahead with a single setup, that will be itself a good creation for the benefit of the patient, for the benefit of their own. Both. So like this, we are here to generate all max possible. We are getting back the investors.
Thank you for handing over the session to me, and I would like to have a brief summary of my experiences, which I have. Actually, I am in for the hospitals, for building up their setups and institutions. So we do feasibility studies, help the institutions to do the planning and designing of the hospitals, come up with various specialities, and make their institutions profitable also. So it is a part that, we look into the first year of their operations and management. And in my opinion, there are a lot of the cost cutting measures for the new entrepreneurs. There are a few points which I would like to share with my experience. Is that first one is that look into the spaces beyond the metropole. That is the first point. In tier 2, tier 3 cities where the penetration of other consultants and doctors is less, patients are much more. So your stability and establishment will have much more scope as compared to the metropole city, where already there are a lot of people who are having their own setup. So that is one takeaway home point. Plus, you should also look into the catchment area, like the population which you are going to cater with your own institutions. The third point is that while building up, you should be looking into if you can get the land in some government schemes, that will help to actually reduce down the cost of the hospital building up. Fourth point is that you should also be looking into the equipment cost. what you are going in. And if you are doing a feasibility study about the scope of services which needs to be included for the hospital, which suggests that if you are going for a low-cost hospital, the new upcoming entrepreneurs should start with the specialties which they are going to cater themselves in the hospital, and then gradually building up other specialties. Also looking into the expansion part of the hospitals and increasing the services. When you are planning a hospital, there is also one takeaway home point that you should be including is that the human resource cost should be also calculated for 1 year. Rather, when you have come up with your own hospital, the operation cost for 1 year should also be included. So I think these are 6 major points around which you should be looking into your hospital. We can further elaborate if the people are coming up with the question and answer, and I would love to answer that. And apologies, I have to actually close it with this, and I would love to take the question and answers, and then we can also have some further sessions on these, much elaborative on the costing part and how a planning designing can come. And definitely, as has been mentioned by my colleagues earlier, that you need to be looking into the planning part by involving the technical expertise beforehand, so that you are going to save upon time and money both on not losing on the operating cost for yourself. With that, thank you for handing over the session to me, and I would like to have a brief summary of my experiences which I have. Actually, I am in for the hospitals, for building up their setups and institutions. So we do.
I'm a dermatologist practicing at Kolkata. So if I want to build a aesthetics clinic and dermatology clinic, what would it be better if I bought the property or take the lease or in rent? And in other words, if I bought the property, then what will be good if I take a loan or buy it, wait for some years and buy it by myself?
Yeah.
What will be good?
Sariyar sir, very good evening.
হ্যাঁ, good evening. Very good.
আমার ভীষণ ভালো লাগলো যে আপনি অ্যাজ এ ডক্টর এবং আপনি একটা ক্লিনিক খুলতে চাইছেন। সত্যি আমার এটা সত্যি ভালো লাগলো। ফার্স্ট অফ অল আপনি কতদিন ধরে স্যার প্র্যাকটিস করছেন?
5 years.
5 ইয়ার্স স্যার। এটা স্যার কোন এরিয়া?
বারাসাত।
বারাসাত স্যার। ওকে, মানে বারাসাত এই সিটি মেগা সিটি হসপিটাল এই জায়গাতে।
হ্যাঁ।
ওকে। আমরা রিসেন্টলি মেগা সিটিতে আমরা 3খানা মডুলার অপারেশন থিয়েটার বানালাম। আমি স্যার যেটা আপনাকে আমি সাজেশন দেবো, যেটা আমি করে এসেছি, বেসিক্যালি আপনি ইমিডিয়েট বেসিসে আপনি ওন প্রপার্টি আপনি নেবেন না। ফার্স্ট আপনি অ্যাটলিস্ট 10 ইয়ার্স এর জন্য একটা লিজ প্রপার্টি নিন, এবং 10 ইয়ার্স এর জন্য লিজ প্রপার্টি নিয়ে আপনি একটা ডার্মেটোলজি, এখন তো স্কিন কেয়ারের উপর খুব সুন্দর আপনার কাজ করা যাচ্ছে এবং ডে কেয়ার ইউনিটের উপর করা যাচ্ছে, এবং সেটা খুব সুন্দরভাবে আপনাকে একটা অ্যাস্থেটিক লুক দিতে হবে। মানে যেখানে গিয়ে আপনার যারা পেশেন্ট তারা যেন ফিল করে যে মানে অ্যাকচুয়ালি স্কিন বা ধরুন এই ধরনের ডার্মাটোলজি যেসব ট্রিটমেন্ট গুলো হয় সেটা কিন্তু একটা বিউটিফিকেশনের একটা আন্ডারে। তো যখন পেশেন্ট আপনার কাছে আসছে, আপনাকে কিন্তু ফিল করালে হবে না যে সে একটা হাসপাতালে আসছে। তো সেভাবে আপনাকে ডিজাইনটা করতে হবে। আমাদের কাছে ফাইন্যান্সেরও অনেক রকমের স্কিম আছে, যেরকম নিউ এন্টারপ্রেনিয়ার, শুধু আপনার এমবিবিএস এমডি যে হাইয়েস্ট ডিগ্রি আপনার ডিগ্রি আছে, সেই ডিগ্রির ওপরে আপনি বিনা ইন্টারেস্টে 1 বছরের জন্য আপনি আমরা আপনাকে ফাইন্যান্স করিয়ে দিতে পারবো, শুধু 2টো ডিগ্রির ওপরে। এটা আমাদের এমএসএমইর সঙ্গে আমাদের কিছু ফাইন্যান্সারের সঙ্গে আমরা টাই আপ করিয়েছি। এটা ইন্ডিয়াতে আমরা 3টে কোম্পানি পেয়েছি, সো আমরা তার মধ্যে একজন। সেক্ষেত্রে আপনার যদি আপনি 1 বছরের মধ্যে করতে চান, তাহলে আপনার উইদাউট এনি ইন্টারেস্টে আপনি ফান্ডিং করতে পারবেন। আর যদি আপনি লং টাইমে করতে চান, তাহলে ব্যাংক ইন্টারেস্ট থেকে অ্যারাউন্ড 1.5% মতো আপনার কম থাকে, তো সেটা আপনি ইজিলি অ্যাক্সেস করতে পারবেন। তো এইটা হচ্ছে আপনি বেসিক সিনারিও। আপনার একটা ফাইন্যান্সের দিকে চলে গেল, সঙ্গে আপনার একদিকে চলে গেল আপনার যে ইনভেস্টমেন্টের রেশিওটা, যেটা আপনি লিজ প্রপার্টির ওপর দিয়ে করতে পারবেন, যেটা অ্যাটলিস্ট আপনার 10 বছরের জন্য একটা এগ্রিমেন্ট আপনি করতে পারবেন, এবং যে সেন্টারটা আপনার হবে সেটা একদম অ্যাস্থেটিক লুকিং এর মতো হবে, যেন ফিলিং নট লাইক এ হসপিটাল। তো এটা যদি আপনি করতে পারেন, তাহলে আমার মনে হয় আপনার প্র্যাকটিসটা খুব সুন্দরভাবে করা যাবে।